bit about myself. Hello, I'm an associate professor at UNK in the psychology department. This is my 7th year here at UNK. I got my PhD in industrial organizational psychology, which is the intersection of business and psychology. My specialty is occupational health and safety, which means that I do a lot of research in the healthcare setting on nurses, physicians, PAs, CNAs, all healthcare workers. So I'm really happy to be here tonight and talk about stress management. Not only that, that little guy there in Mickey Mouse ears was actually born at Kearney Regional 15 months ago. So I am happy to be back here and contributing to the hospital that gave me so much. So we're going to talk a little bit about stress reduction. Unfortunately, none of my hobbies include stress reduction other than reading, so maybe I should take my own advice, right? I'll add getting massages to the hobby list. So today we're going to talk about just understanding stress and what it is. Before you can change anything stressful about your life, you need to understand what it is. After we do that, we can talk about coping effectively, and we'll end with some general suggestions for coworker support and some action steps that you can take. Let's begin by exploring stress. I'm going to trust you on the chat. Okay. All right. You've probably heard people say that work is stressful or family is stressing me out. And you understand what people are generally trying to say, that there's something in their life that's demanding resources out of them, time, energy, money. Something challenging is happening in their environment. And as a consequence of that, they feel uncomfortable, they feel upset, they know they can't deal with the demands of their environment. And as a consequence, they feel tense and uncomfortable. Stress is pretty pervasive, so you think it'd be easy for us to understand what it is. But I want you to look at a couple sentences with a more nuanced eye. Our first sentence here is, I am under a lot of stress. What this sentence implies is that there's some kind of external event in your life that's causing you to feel unhappy. So there's a stressor out there and it's making you feel uncomfortable and frustrated, right? But the question is, what is stress the cause of, right? Like what is actually going on here? So the first term I'm going to give to you is stressor. And the stressor is the cause or stimulus of that uncomfortable feeling. Stress is actually a little more complicated. We have that cause and the effect. The stressor is the cause, and that includes things like conflict, heavy workload, seeing trauma in the workplace. You can compare that to the other common type of sentence, work is stressful. And with this kind of sentence, what we're saying is that stress is the outcome. So you're busy at work, you're running around taking care of patients, and as a consequence of that, you feel stressed. In this sense, stress is more of a reaction or outcome or a response to the situation in your environment. You can have a lot of stress reactions. We call them strains. In this kind of situation, it can be behavioral responses. You go home, hide your head under a pillow, lock the door. It can be emotional responses. You cry on your way home from work. It can even be physiological responses, like getting headaches or upset stomachs because of what's happened. All right, so we've got a couple different ways of thinking about stress. Is it the cause or the effect? Is it the stimulus or is it the response? Maybe stress is a little more complicated than that. Maybe it's more of an interaction of the person and their environment. And maybe a person can be an active agent in influencing what they perceive about the environment around them. I want to propose to you this third approach to stress that says that stress is a process, and it includes the cause and the effect, the stressors and the strains. It's a continuous transaction between a person and their environment. That means that every single day you go into work and you're assessing how many patients you have to take care of. I'm assuming you look at their acuity, even though it's like the nurse's prerogative, you still have to worry about that too. So you're constantly evaluating what the demands are in your workplace environment and trying to figure out if you have the resources to deal with those situations. You're an active agent in evaluating that situation, and you can have a positive effect on how you experience it. You can make some behavioral changes, for example, going to the gym, moving to a new apartment, reframing the problem, seeking therapy, We're going to get to how you fix stress in a little bit. But first, I just want you to understand that you can make actual changes to your environment, to your perceptions that can make you feel better about what's going on. All right, we've talked about some definitions of stress. We've talked about how it's kind of an interaction, but what actually causes that stress? There are multiple causes. I'm going to start by just mentioning individual causes. This can be anything from getting diagnosed with a disease to worrying about your future. It can include social rejection, which actually activates the same part of your brain as feeling physical pain. So when someone says, no, I don't want to go on a date with you, it can actually feel physically painful. That's an individual stressor. And maybe more importantly, interacting with people who are at a higher social status is a very stressful situation for individuals. So for example, with CNAs, when you perceive doctors as being at a higher status and you have to interact with them, it actually evokes physiological stress responses. Your heart might start racing, your stomach might get upset, maybe you get a little sweaty. That's because you're having to interact with someone who's at a higher social status. Many sources of stress just from within you. But beyond yourself, you also have to worry about your family, right? Anything from having a new baby, to having difficult children, to having an illness in the family, the death of a loved one, even divorce counts. And I know it seems crazy, why would babies be a stressor? But you do have to take care of them. It is a huge time commitment and financial commitment, and not just for the mom, but for partners as well. Partners will worry about the health of the mom, the health of the baby. They'll pick up extra tasks around the house, and they worry about their financial health as well. How are we going to afford this baby? Family is a double-edged sword. They're a great source of comfort, but also a great source of worry, right? However, what I'm going to focus on today is job stressors. Job stressors. What I did for this presentation was to create this entire list of potential job stressors you may experience. Believe it or not, these stressors are across workplaces. This includes healthcare, construction, retail, even education. These are common stressors across fields. And let's look at them in a little more detail. We begin with task demands. Just literally, what do you have to do at your job? For example, people who have high workload, people who work nights, or who switch from day to night, people who have repetitive manual actions like lifting patients, and people who feel like they don't have control over their position are more stressed out. Workload's a bit of a tricky one, especially in healthcare, because if we were working in a widget factory and we were told to make 100 widgets instead of 50, we would see that's a greater workload. But within healthcare, it's not like one patient equals one workload. It's a function of their acuity level and the ratios. So it's a complicated matter. But if I were just to ask you, what's your workload like today? You could tell me if it was hard or easy, right? So there's nuances to workload. All right, so that's just the job tasks themselves. There's so much more, such as being responsible for people's lives, having to make life and death decisions daily. There's little to no margin for error. Not only are you caring for their physical well-being, you have to think about their emotional well-being as well. That usually does fall to CNAs and nurses. Usually physicians aren't in there long enough to help out with the emotional well-being. So it does fall to you to make sure your patients are okay. Seeing trauma as well can be very difficult. All right, so we've got the tasks. We've got just caring for people, but not only that, you're caring for your coworkers. Your coworker relationships can be a source of comfort, but also a source of conflict. For example, nurses have very high rates of conflict among units. It does depend a little bit on the culture. So it's a function of the supervisor and if they create a supportive climate or if they are okay with more of a climate of conflict. So it is very common for there to be conflict in workplaces for healthcare workers, not just for your coworkers, but also patients and their families. Violent patients are a little more common among some units like emergency departments and psychiatric units, and that's because you're dealing with special populations. It's usually people who have alcohol or substance use problems. In the psychiatric units, it's usually people who are having active psychotic episodes. When you combine the two, it's a recipe for violent patients, unfortunately. And if you don't have support from your coworkers, you can easily see how this would be a huge source of stress outside of just doing your job. Last but not least, the physical environment itself. I don't think maternity, you're pretty quiet because you've got the babies down there, but I know the ICU, there's a lot more machines that are beeping constantly, and I know you get them too. Having loud, repetitive noises, working in hot or cold temperatures, and illumination. So these are factors that stress out people on the job, but I'm guessing that people watching this recording, that you can probably check almost every single one of these as something you've had to deal with on the job. And that's what makes healthcare so special. And this is why you're the superheroes, because you put up with all of this and still provide high quality care. So yes, there are many reasons your job could be stressful, unfortunately. As I was preparing for this presentation, I wanted to understand a little bit more about the different occupations in a hospital and their levels of stress. What I found was a study that was pretty recent. They surveyed 20,000 healthcare workers to find out how stressed out they were. The figure's a little funky, so here's how I want you to interpret it. If the dot is closer to the middle, that's low stress. As the dots get closer to the outer edges of the spider web, that's higher levels of stress. What these researchers found was that there are certain occupations within the hospital that are experiencing high levels of stress, such as CNAs, nursing assistants, medical assistants, and social workers. So I'm glad to be here today talking to those of you who are the most stressed. Beyond the occupations themselves, there are other groups that are higher risk for stress, and these include women compared to men. It includes inpatients. They tend to have higher rates of stress than outpatient clinics. And beyond that, Black and Latinx workers report higher levels of stress compared to white workers. So you can see how these different variables would combine. If you're a minority CNA in an inpatient setting, then you are at high risk for job stress. I don't really think you need me to sit here and tell you that you're stressed, right? That's the whole point of the presentation. Let me tell you why it matters so that you want to fix it. Stress is related to a number of unfortunate outcomes. I've listed a couple here. This list is not comprehensive, but what I do have is relevant to the healthcare field. These studies come from surgeons, nurse anesthetists, even paramedics. And what we find is that when people are stressed out, they're at a higher risk of burnout, turnover, quitting their jobs, alcohol and substance use, higher rates of safety incidents, hypertension, erratic heartbeat, even increased inflammation. I'm going to focus a little bit on burnout in the next couple slides, but before I move on, I just want to reflect on turnover. I don't talk a lot about COVID in this presentation because I think we get enough of that every day anyway. But turnover has definitely increased over the last year. Right now, the average national rate of turnover in a hospital is 19.5% of the employees, and that's up from previous years. At the administrative level, one should care about this, because if you reduce turnover in nurses by 1%, you can save about $280,000 a year. Keeping your employees happy literally saves you money. So that might be a good way to convince admin to have more of these sessions, right? So not only does stress affect you, it affects the people around you as well. One of the many conversations I had with Amanda was about burnout and how we're all struggling with it. So that's where I wanted to focus a lot of this presentation so that we can understand what it is and then how to mitigate it. Burnout. The profound emotional and physical exhaustion that helping professionals and caregivers can develop over the course of their career as helpers. You can think of it as this gradual erosion of what connects you to other people. You feel less empathic, you feel less compassionate, and you start to see not the person, but just kind of a patience. You become disconnected from them. So rather than giving them a name, you might just name their room number instead. It's kind of like depersonalizing who that individual is. When people start to become really burnt out, They can create this toxic work environment. They get frustrated with their coworkers. They're short-tempered with loved ones, even feel guilty about all of the demands on their time. And burnout sounds like this horrible, terrible thing, and why would we want it? It's awful. I don't want you to think about burnout like that. I want you to think of burnout as the cost of caring for other people who are in emotional pain. It affects teachers, police officers, CNAs, nurses, doctors, social workers. Basically, it's people who are in those frontline positions who see trauma, who see emergencies, even teachers do, little kiddos, right? They're at a higher risk of burnout because they're dealing with that emotional labor all of the time, unfortunately. Here's the funny thing about burnout. When you're burned out, you actually work harder. You dive into your work. And I think it's kind of a way to distract yourself from how you feel, so you just work harder. Unfortunately, it creates this downward spiral of feeling more burnt out and more burnt out and more burnt out. And that leads to bigger health problems like depression, anxiety, maybe even substance abuse. All right, so it still sounds bad, but let's reframe it a little bit. Burnout is an occupational hazard, same as needle stick injuries. It's not necessarily a mental health issue. It's not a weakness. It's just the price of working in a job where you have to care for other people. And that's okay. That's okay. It means that if you're in this profession and you care about people, that you might have to watch out for these symptoms of burnout. And burnout will ebb and flow from day to day, but you'll be able to identify some of the symptoms. I'm going to talk about them in the next couple slides. So my takeaway for you here from this slide is that burnout isn't necessarily bad. It's a disorder that affects those who do their work well. In other words, you don't develop burnout because you did something wrong. You develop burnout because you care too much. So let's fix that. Well, we want you to care, but we want it to not hurt you, right? So let's fix that. What we've got here, you can think of it like a spectrum, a burnout spectrum, all right? Being able to identify your symptoms on this spectrum is important because it serves as a way for you to put words around how you're feeling if you weren't able to do that before. Identifying the problem is the first step. Not only that, it helps you identify and create this warning system. So if you start noticing, you know, I'm ignoring calls and I don't usually do that, that's a sign. Pay attention to how you're behaving, and you can say to yourself, you know, that means I'm a little burnt out. It's time to take care of myself. I want you to use traffic lights for this analogy here. So we've got the green zone, our optimal performance. Honestly, this is really rare. We don't live in this zone, unfortunately. It's basically the day after we come back from vacation and all of our laundry is clean. For the most part, we live in the yellow zone, our typical performance. And that's okay. It's where we spend most of our days. It's a little worrisome when we start getting into the red zone or the danger zone. This is when people are so burnt out, they're calling out sick, they're clinically depressed, they're drinking to cope with their problems. We all get into that red zone at some point where we're super stressed out and withdrawn from others. That is totally normal. It's absolutely normal to be in that red zone. However, it affects our emotional health, it affects our physical health, it affects our relationship with our families, with our coworkers. It makes us less compassionate. We're at higher risk for clinical errors when this happens, which means we don't want to be in the red zone. We at least want to live in the yellow zone. All right, so you could probably think about some challenging coworkers you've worked with in the past. I know we've all been that challenging coworker at some point who's feeling a little burnt out, and that's okay. Given this reality, I want you to reframe it. I don't want you to think about how someone is a challenging coworker. I just want you to see it as a symptom of burnout. And I want you to think about it like this little dragon that lives on your shoulder. Sometimes the dragon is small and green and super happy. Sometimes he's a little bit bigger and yellow. What we care about is when that dragon gets really big and bright and red and blows fire all over your coworkers. We don't want to be in the red. Don't want to be in the red. So I want you to think about what your dragon looks like. At a 1, you're just happy as you've been on vacation. But what does a 6 look like for you? Is the 6 when you stop going to the gym? Is the 8 where you stop picking up your phone? I'm guessing 10 is the days when you go home after work and you lock the door and you close the shades and you unplug your phone and you just hide under the covers. You can start thinking about what behaviors you exhibit when you're feeling burnt out. So for example, for me, I find that at around 6 is when I stop going to the gym. I'm like, I just can't do it. And that's when you need to go, right? Otherwise, I tend to start ignoring phone calls, or I don't call people back. Sometimes it's, not going out to eat with a friend or just ignoring their text message. Being able to recognize what color dragon you have, what level of burnout you have is critical, because then you can identify when you're getting into the red zone so that you can fix it early on. An ounce of prevention is worth a pound of cure. Identify it while you're in the orange and you'll be in a better place. It's more effective to change it when you're in the yellow. So chat wasn't successful in the afternoon meeting. That's okay. I've got some cool worksheets that I'm going to pass out instead. So I'll pass them along to Amanda, and you can actually work through some of the behaviors you've noticed in yourself. But what I really want you to pay attention to is what's helpful for you in these situations. What helps you when you're feeling burnt out? Now that you're in the second round, what helps you? You're going to be my audience member, Amanda. Come on, what do you got? Like, what helps when you're feeling burnt out? What do you see? Like, I don't know, anyone. What works?
Like work-wise or like personally?
Let's do work-wise.
So we're really good about debriefing after we have kind of like stressful situations on the floor. And I think that kind of helps because we just, get to talk about it and then, like say what worked in the situation and, what we could have done different. I don't know. I'm a big talker, so talking it out.
Yeah. So that's a good match then, because they're giving you the opportunity to talk about what happened, and that's what you need. So debriefing is really important. All right. I wonder if all the units are like that. That would be interesting to find out. I saw in the chat, Jennifer says she likes to plan vacations. Amazing. So we've got work examples. I also love planning vacations, and I think it's kind of like the anticipation of Christmas, right? It just builds up over time. So finding ways that you can reduce that stress, very important. Now I'm thinking about where I want to go on vacation. Obviously Hawaii. All right, so we've talked about what stress is. We've talked about where it comes from. We've talked about how it's not good for you. Let's get to the good part of the presentation and talk about what you can do to cope a little more effectively. When we're burnt out, when we're stressed out, we're uncomfortable. And because of that, we're motivated to do something to change that discomfort, to make it better. That thing that we want to do is called coping. The process by which people try to manage the perceived discrepancy between the demands and resources they appraise in a stressful situation. That's a mouthful now that I look at it again. All right, so the key word here is manage. What that means is that not everyone is successful in managing that discrepancy. All right, so a simple example I use with my college students is, let's say, goodness forbid, you get in a car accident and you have to find $600 to fix your car. That's a demand on your resources, $600 that you have to come up with. But do you have the resources to deal with that demand? Do you have $600? For college students, that's a big deal. That's a major stressor for them. So you have to think about what's being asked of you and what resources you have available to them. Some types of coping are more effective than others. So we'll talk a little bit about ineffective and effective coping on the next slide. Okay, let me explain this to you. So we have two types of coping. We have emotion focused, which are the first two columns, and problem focused. We'll talk about that one next. All right. With emotion-focused coping, we're just trying to change our emotional reaction to a situation. We're just trying to change our emotions. And there's a couple different ways we can change our emotions, with a behavior change, so we can actually do something different, or by thinking something different. We're not changing the situation, we're just changing how we feel about it. Some examples here for behavioral: drinking alcohol, using drugs. Obviously, hoping this is obvious, these are not effective types of coping. In the short run, they can certainly make you feel more relaxed. They can make it feel like you don't have as many problems, but I assure you they create more problems than they solve. It's not an effective long-term strategy. Seeking social support from other people, whether coworkers or family members, can absolutely be helpful. You're talking to someone to change how you feel, maybe about that traumatic situation that you experienced last week. With the cognitive side, we're just trying to think differently so that we can feel better. So we can redefine the situation, or we can avoid it altogether. Some examples of redefining the situation might be like trying to find the silver lining in something, or calling something a blessing in disguise. Some of us have had a pet that's passed away, and we'll talk about how that pet crossed the rainbow bridge. Maybe grandma is up in heaven with grandpa now, right? You see how you're not actually changing anything about the situation, you're just changing how you think about it. And I know it seems a little optimistic for me to tell you, just think different thoughts, turn that frown upside down. But there's power in being mindful of how you interpret a situation. If something goes wrong, you say, this is garbage, it's never going to work out, I hate my life, what am I going to do? Thinking negative thoughts isn't going to make something positive. You have to change how you're interpreting that situation, the literal thoughts that you're having about that situation. And rather than saying something sucks all the time or things are terrible, you need to be very specific about that event. So what's a good example? Redefining the situation. I don't have a lot of patient experience like you guys do. I'm thinking something like, well, okay, I have learned a lot from this event that happened in the workplace, maybe made a mistake. I have learned what I should not do. We caught the mistake in time, and the patient is happy with their care. You're literally just thinking different thoughts about that same event. Avoiding the situation is kind of a bit of a double-edged sword, because there's power in denying something stressful has happened. But let's say, for example, you get diagnosed with gestational diabetes. I'm going to use that example. Then if I were to avoid that situation as a way to cope with that stressful diagnosis, it obviously would not work out well for me or my baby at all, right? It's helpful when people use it for certain types of situations. However, so for example, the death of a loved one. Sometimes people just kind of ignore any thoughts about how that loved one has passed away by focusing on the funeral and the funeral arrangements and being the executor of the estate. So it is a coping mechanism. It is effective in some circumstances, but not always. You have to be careful with that denial and avoiding. For the most part, we use emotion-focused coping when we think there's nothing we can change about the situation. If you think there's nothing you can do, why would you try and solve the problem? What you can do is change how you feel about the situation. That's why emotion-focused is very helpful when we're talking about a loved one who's passed away. With problem-focused, you're either trying to reduce the demands on your time, money, energy, or expand your resources. And there are a lot of different ways to do this, whether it's moving to a new unit, getting an extension on your rent, hiring someone to clean your house, doing DoorDash instead of cooking food for yourself. Outsource if you can, absolutely, it'll be better for your mental health. It might mean seeking medical treatment or going to a therapist, finding resources to help you out. People tend to use problem-focused coping strategies when they think there's something they can change about their lives. When they think they can change it, they try to change it. When they think they can't change it, they don't. So there's power in the thoughts that you have in changing your behaviors. Is there something else I'd said last time that was good about this? I feel like I'm missing. I forgot what it was. Oh, yeah, right. So there's demographic differences as well. So for example, if we're going to use anything, we tend to lean towards emotion focused. We use a combination. However, people who have more resources, literally more education, more money, tend to use problem focused strategies because they feel like they can make changes. For people who don't have the education, that money, or the power, they tend towards emotion focus because that's literally all they can do. There are a lot of different factors that predict what type you use, but for the most part, we kind of use a combination. The point I want to make with all of this is that it's a process, all right? This coping isn't just a one and done event that happens in your life and you're good to go, right? It's a continuous transaction every single day between you and your environment, your demands and your resources. It's dynamic. It's a dynamic series of appraisals, at least until you're retired, right? So I don't want you to think of it as like this, oh, great, I'm gonna get stressed, deal with it, get better, but then get stressed again and you get stuck in this cycle of feeling stressed. Don't think of it like that, because then it kind of feels a little bit like you're Sisyphus, right? I don't know if he was Greek or Roman. He was an ancient myth of Sisyphus, and he had to push a stone up a mountain and it would just fall down. So the story is he spends eternity pushing a stone up the mountain only for it to fall back down again. And sometimes coping with stress feels like that. It feels like this never-ending cycle of stress, better, stress, better. That's okay. Don't think of it like Sisyphus. Don't think of it like this negative event. There are ebbs and flows. There's a time for everything. Sometimes you'll be stressed, sometimes you won't. Sometimes it's helpful to remember that there's a cycle, there's ebbs and flows, because then it's easier to see the light at the end of the tunnel. If you're having a hard time, remember it does get better eventually. There's a cycle to this. Embrace the ebbs and flows. All right, now what you can do, and I'm not going to ask for any responses or anything, I want you to find out how you cope with stressors. So whether it's writing down the numbers 1 through 12 on a piece of paper or doing it on your phone, I think you could probably eyeball it with the questions and count them up. What I want you to do before I show you the questions, I want you to think about a very stressful personal crisis or life event that's happened to you recently, preferably in the last year. The more recent, the more stressful, the better for this activity, because it'll be more salient to you. And I want you to think about how you handled that situation. How did you cope with that stress? What's on the next slide are different ways people tend to cope with stress. When you take a minute here and count how many of these things you do. Try to see a positive side, prayed for guidance or strength, got busy with other things, decided not to worry. Did you read relevant material? Did you talk to a friend or relative? A professional includes any kind of adult, whether it's a lawyer, a doctor, a pastor, a priest, therapist, a teacher, counselor, whatever. Did you talk to an adult? Did you actually take action to improve the situation? So once you've got your check marks on all of these different ones, you can count up how many you have from the left column and how many you have from the right column. So you'll have 2 separate numbers, one for each column. The left side, I'm assuming you're ready. The left side is emotion-focused strategies. The right side is problem-focused strategies. And if this were a real classroom, I'd ask people to raise their hands and tell me if they did mostly emotion or if they did mostly problem. But I do this every semester, and I can pretty much predict that you have a combination of these different coping strategies, right? We tend to not just use one only, we tend to use that combination. So in the real world, We're not all using emotion focus. What happens is you have a rough day. We'll go back. There we go. If you have a rough day, something really bad happened at work. What do? You say, hey, coworkers, I had a really rough day. Can we go to Jersey's? And can we talk about the situation? I need to figure out what happened, and then maybe you can brainstorm some actual solutions. We use a combination of the strategies as we're coping with stress. All right. Okay, so we talked about stress, what it is. We talked about its sources. We talked about why it's no good. We talked about coping. Let's continue on this coping journey. I'm going to give you some tips for just reducing stress, reducing the potential for stress. I don't have everything I wanted to put on here because we could be here all night talking about that. So I'm going to focus on self-care, and I'm going to talk about social support. But before I get to those slides, I'm going to tell you to Google mindful meditation apps, because there are some good ones out there like Smiling Mind, which is free. Also Headspace meditation apps. A lot of people find them really helpful to listen to as they're falling asleep. I know the Smiling Mind one is an Australian guy, and apparently his voice is very relaxing to listen to. So I can start with that one. Beyond that, you could also look up progressive muscle relaxation. There are a lot of great YouTube videos out there. There's one through Emory University. They're simple, they're easy to do. You can do them sitting in a chair in front of your computer. And it's literally just tensing your muscles and releasing them. It's really helpful if you're stressed out or if you're trying to fall asleep. So those are your hot tips outside of the lecture. Let's talk about taking care of yourself. Well, guess what? There's a lot of different ways to do that. Physically, psychologically, emotionally, spiritually, even in your workplace. This is one of the handouts I'm going to pass along to Amanda as well to share with everyone. This is a whole worksheet with a checklist as well. So I'm just going to show them to you, and you can reflect on which ones you can do, which ones you don't want to do, which ones might be impossible. So for example, eating regularly, exercising, exercise. That's your hot tip too, exercise. You need one more person telling you to exercise, right? Definitely do that. Get medical care, take time off when you're sick. The Wren Institute in town gives some pretty cheap massages because they're students. So if you're feeling guilty about taking care of yourself, start there. I haven't been yet. It's on my to-do list. I got to take my own advice, right? The Wren Institute. And Jennifer's got the right idea. Take a vacation. Absolutely. Some of them are a little more difficult than others, right? So making time for self-reflection. Some people don't really care about being touchy-feely. If you don't, then you might enjoy gratitude journaling. Literally every night before you go to bed, you write down 5 things you're grateful for. Over time, you're going to collect an entire list of things you're grateful for. And it's fun to flip back and look at things you've completely forgotten that happened to you and feel excited all over again. I had that happen. I won. It must have been $50. Maybe it was 100. I was a grad student, and $50 seemed like a lot of money. And I won it. I was so excited, and then I forgot 2 days later that it happened until I read about it in my diary. So try that one if you want. Reading literature outside of work, to the extent that you can. Going different places is a lot of fun. Maybe it's an outdoor sports event. I went to the Hastings Museum last weekend, and there was no one there, and it was really fantastic. So, you know, to the extent that you can, getting out and going and doing new things is really important. The whole purpose of this lecture, decreasing stress in your life. Check. All right, emotional self-care, spending time with others whose company you enjoy, giving yourself positive affirmations. It's okay to cry. Play with children, they'll make you laugh. I don't know about you, but I found in the last year and a half that I've really been reaching out to family way more than I ever have before. Just, you know, updates on health and updates on the kids. And it's been really neat. It's one of the silver linings of COVID is that I've been talking more with extended family than I ever have before. Next up, spiritual self-care. It's not specific to any one religion. It can be finding a spiritual connection in your local church or synagogue. It can be as simple as joining the YMCA. So you have to find your community. Spending time with nature, cherish optimism. meditate, mindful meditation. This will take different forms for different people. Some of you want to check everything on this list. Some of you say, nope, this doesn't even matter. I'm giving you these suggestions so that you can pick just a couple that work well for you. Last but not least is the workplace one. And I think this is the hardest one because there are some literal limitations to what you can do and what you can't do. So there may be days where you can't take a break for lunch, but you should always fight for those breaks. Fight so that you can eat, so that you can drink water, go to the bathroom. That's important. You have to take care of yourself. Chat with coworkers. It's impossible to set limits, right? You just, yeah, like the patient needs what they need and you can't say no. So some of these are physically impossible within the healthcare setting. That might mean choosing something from another list instead. Certainly having a peer support group is important as well, especially during COVID times. We were talking before the presentation about how if it's Facebook or Twitter, there are groups out there on social media that are going through similar issues, and just reading stories from other people can be really helpful too. All right, I want to focus on coworker support because we're talking about the workplace. Skip a slide. Okay, when you're stressed out, it changes your behavior to other people. And in some situations, that's okay. For example, if there's a natural disaster, people will come together and provide support and comfort for those who are suffering. However, in other stressful situations, people become less sociable, they become more hostile, they become insensitive to the needs of others. And this is what we're really worried about. And it's kind of a specific subgroup of people. It's those type A competitive types. Some of them, not all, they get angry when they're stressed out. When people get angry, it leads to aggressive behavior. And we don't like that because aggressive behavior in the workplace makes for very unhappy coworkers. It can lead to poorer outcomes for patients as well. My important recommendation, if you're struggling with a coworker who's angry, who's aggressive, there are resources, but it's fair to say it's outside your pay grade. You should make your supervisor deal with it. Having supervisor support is absolutely critical. So if you're struggling with aggressive coworkers or patients, then you need to escalate that to the next level, absolutely. Rather than talking about the negative, let me tell you about some of the positives of supporting each other in the workplace. So this was a study that was conducted a long time ago in 2004, and they surveyed patients and asked them some questions. They also surveyed doctors and nurses. And what they found is that patients who were on units that had administrative support and adequate staffing and good doctor and nurse relations were happier. It increased patient satisfaction. When you're working together as a team with administration, patients are happier, which means more money. So you definitely want to do that. But not only that, when you all work well together, it leads to lower burnout and people are less likely to quit their jobs, which means the foundation is making sure your coworkers are happy and healthy. CNAs all the way up to the docs, all the way up to admin. How can you support each other? There's a couple different ways. What I have here is a list of 4 common types of social support. First, I want to talk about is esteem or emotional support. This is when you're just being empathic or compassionate to another person, and they feel comforted, they feel reassured, they feel like they belong when they're really stressed out. Tangible or instrumental support is exactly what it sounds like. It's direct assistance, and you can think of this as like money, right? So some kind of loan that someone gives you to help pay for a house deposit. Informational support includes advice, directions, feedback for how a person is doing. And last but not least is companionship, when you're just available to be there for another person. And I'm thinking about the debriefing that you mentioned earlier and how it's kind of a combination of these different things, right? I mean, I don't know about tangible, but they're definitely there to comfort and work through that. They're with you, talking to you, and I'm sure they can give you some helpful feedback if this happens frequently, or comparing it to other situations. So the debriefing seems like a great way to provide a lot of social support. Now I want to know if all the units do it. That would be really cool. So a takeaway from this slide that's important is that some people need certain types of support. You need to know what kind of support they need. So what a person needs and what another person has to offer, they have to match. People don't always get what they need. All right, so some examples for you here. People who are pregnant like tangible support. So yeah, baby showers, right? Bring me diapers, bring me cash for my baby, right? People who are struggling with cancer diagnoses prefer emotional or esteem support. It's very specific to individual situations. What you need to do is ask people, what do you need? How can I support you? And then provide the support that they ask for. I guess it does assume people are self-aware about the type of support they need. I don't know if that's always accurate. I mean, food's always good, right? We always need food. So can we start with that? Some cupcakes or something. All right, so we're doing pretty good on time. I'm going to end with some takeaways here. Just, some pro tips for you. Have that social support, whether it's at work or at home. Be self-aware of your own symptoms. Take care of yourself to the extent that you can, balance work and life. But again, there's ebbs and flows. Right now at UNK, things are just crazy busy. So I'm heavy on the work, light on the life. But that's okay because I know summer times it does shift. I'm sure there's seasons for babies, right?
Oh my gosh, yeah.
When do you get the most babies?
Right now.
Oh, New Year's, Christmas babies.
Mm-hmm.
Yeah, that's it. So, all right, so now might be a stressful time, but hey, give it a couple months, it'll get better. Yeah. People who are satisfied with their jobs are less burnt out. To the extent that you can, rebalance your caseload or limit trauma. Whether you talk to a coach or a therapist or a physical trainer or anyone, or it's just good clinical supervision, go find an adult who can help you out. One of my students said once, oh, so I have to find an adultier adult than you? And I was like, yes, that's a lawyer. An adultier adult. And attend professional development. Even better if you can find a nice conference in Hawaii, right? So some reflection here. I think this might be something you could talk about later with your units, right? Just getting advice. I know one thing that the maternity unit was interested in was hearing from the ICU about how to deal with COVID patients. Did you ever get any good advice about that?
Kind of from the CNAs, but
the CNAs.
Yeah. We, knock on wood, really haven't had very many.
Right.
So
knock on all wood. Yeah. Yeah. So it's good to be here now. A year ago was definitely a scarier time, I think, for the moms. I know it was when I was pregnant. So yeah, keep having those conversations with your colleagues. That's super important. My takeaways for you here, because you can't pour from an empty cup. You have to take care of yourself first before you can take care of other people. Pay attention to your dragon. Even better if you notice other people's dragons. I definitely can tell when my coworkers are getting burnt out because they get sassier. Sometimes they close their doors. Sometimes they order out more food. So when I see that in other people, sometimes I'll bring in extra treats or I'll talk to them or, interact a little bit differently. So no dragon, bonus points, right? Support each other, take deep breaths. There's a lot of research out there that suggests that the amygdala, the fight or flight center of the brain, when into action, it sends adrenaline, cortisol rushing through your system. Your heart starts racing, you start sweating, you start freaking out. Oh my gosh, fight or flight. Taking a deep breath slows down your breathing, and it sends a signal to your brain that says there's no danger. So then the amygdala slows down as well. Taking deep breaths calms your system down, guaranteed. Last but not least, I am giving you permission to treat yourself. Sometimes we need to hear it from another person that it's okay to do something for yourself, whether it's sneaking a trip to Target or bringing in cupcakes. Treat yourself, you are worth it. So I'm ending. I do have some contact information here if you want to reach out to me. I'm just on the road at UNK. I'm on our website. I do have contacts. I have an email address, phone number, but I'm going to share all of this with Amanda as well. So if you want to reach out later, you are welcome to. And for the science nerds out there, I have a lot of references, mostly peer-reviewed, supporting everything I have just told you. So again, I want to thank you for coming. I really appreciate it. I'm always happy to talk about stress management. I mean, we all need that, right? All right, thank you so much.